welcome. So today in this session, we're actually going to be talking about hospital-acquired infections, which have also become one of the biggest threats in our day-to-day life. As we visit the facilities for medical attention, we end up getting other infections from the facility. So with your Global Health partner from Global Health Science, Andrew always giving you and always be ready to provide to you at your service. So I want to encourage you to share, like, and follow this video because what is the advantage of subscribing to the channel? When you subscribe to the channel, every time I produce new videos like this, you'll be able to be updated on time and you won't miss out any update that I'm bringing out through this channel. So thank you so much. So today, as I told you, that we're going to be talking about hospital-acquired infections. These are infections that are actually gotten from the facility after 48 hours of admission. In other words, once you get sick and you're taken to the facility, and after the 48 hours, that means 2 days, you developed another complication in the facility. Such infections are called hospital-acquired infections. And there are always factors that predispose or linking factors to such infections in the facility. One of the factors linking as one of the causes behind which these infections develop is the poor hygiene. Poor hygiene in a way that when you go to the facility and there is a poor hygiene, in other words, from the toilets, general sanitation, from the toilets up to the wards that you're staying in, can predispose you to develop another complication after you've reached the facility. Now, in so doing, you realize that even hand hygiene of the medical personnel, in a way that their hands have become a vehicle or a vector for the transfer of microorganisms from one patient to another. And this might be resulting from poor resource allocation, where you go to a facility and there are few gloves being supplied to that facility and different other things that have resulted majorly on the government facilities, leading into transmission of infection from one patient to another. Then we also see what they call the poor sterilization or disinfection of the equipment. Equipment that are majorly shared between one client to another. If they are poorly sterilized and poorly disinfected, they end up being the vector for the movement of an infection from one patient to another. Then we also go ahead and see what we call the inadequate infection control practices. In other words, things like spacing of the patients, the waste segregation, the personal protective gears like the masks. When you go to like wards like TB or any other wards, when you are not protected from infections, you might become a culprit of the circumstance in that very ward and you may develop another infection. That means inadequate infection control practices have also risked clients to getting secondary infections after being admitted in the wards. Then we also see what they call prolonged hospitalization. If you've been admitted in the hospital for a very long period of time, you really stand a chance to get these infections affecting. Then we also see what we call invasive devices. Invasive devices, these are devices that are used in the facility in several occasions to assist in medical care of the patient. For example, the cannulas that we use and the catheters that we use, the nasogastric tubes that we use, if those are equipments that are being used on these patients are not sterile or they are not kept in good conditions, they predispose, they help and aid in the transfer of infections to these patients. And finally, patient might come in with malaria infection and develop sepsis because the patient is in the ward and these equipment that are being used on this patient are not up to date and they are not really taken care of in a good way. Then we also see what we call contamination of water, and then we also see what is that we call contaminated hospital environment. When the hospital environment is contaminated in a way that maybe the water that is being used in the facility is contaminated or the air around the facility is contaminated, it also predisposes these clients to developing infections within the hospital called nosocomial infections. Then we see also what we call immunocompromised patients. A patient that comes when he's already immunocompromised has a higher risk of developing a nosocomial infection within the facility. Why? Because you come when your immunity has been suppressed. Remember, the hospital environment is having a higher saturation of microorganisms in the air and in the soil. And in so doing, when you're immunocompromised, you have a higher chance and you stand a chance of contracting another secondary infection inside the facility. Then we go ahead and talk about misuse of antibiotics. In other words, when these antibiotics have been misused in your life a long period of time and you come to the medical facility, there are higher chances that you're going to develop another secondary infection. Why? Because these antibiotics destroy the normal flora in your body, and once the normal flora is destroyed, it puts you as a patient at a risk of any other intruding microorganism to be able to successfully cause an infection in your life. Then we also see what we call understaffing. In several occasions in these facilities, the number of staff that are present for duty is less than the number of clients to be attended. In so doing, it puts these medical workers onto a standstill where you have to serve a very big variety of clients and provide them with good quality care. And in so doing, you'll get exhausted, you'll get tired, and in several occasions, I've seen medical facility or medical personnel going into the level of even doing cannulation without gloves, because it is very hard to go from here up to the store to pick up gloves and other things. The supplies you're using have gotten finished, and there is no way. Clients need medical attention and medical care. So this understaffing has predisposed so many people into developing secondary infections or nosocomial infections within the facility. Now, I want hospital-acquired infections or common nosocomial infections. We find common nosocomial infections include catheter-associated UTIs or just UTIs. When these patients are put these catheters, sometimes the process by which these catheters are put is non-aseptic, and in so doing, it helps in introduction of microorganisms across the anatomical barriers that would have helped to protect you from a certain infection, and hence helping these infections to gain access into the vulnerable parts of this patient that we receive in the facility. Then we also see what we call the surgical site infections. These ones are majorly common maybe after operation. We call them postoperative infections, which surface after the patient has been performed surgery, but because of maybe poor wound care and other things, can predispose these patients into developing secondary infections inside the facility. Of course, this will be maybe prevalent with seeing patients having passed after a successful theater procedure, or sometimes even the procedure itself was non-aseptic, also predisposing these clients into surgical wound infections after being brought into the facility. Then you also see what we call the hospital-acquired pneumonia. Hospital-acquired pneumonia is one of those major infections that patients gain from the facility, and patients actually get affected and disturbed with. So what could be bringing this hospital-acquired pneumonia? This hospital-acquired pneumonia can be as a result of ventilation. In other words, when these patients come to the facility, maybe because they're immunosuppressed, they might inhale most of these infections and majorly lead into pneumonia. Then, of course, we also have those pneumonias that are caused by mechanical introduction of microorganisms into their lungs. Majorly maybe by use of these oxygen tubes can be one of those underlying causes of this. Then, of course, also mechanical use of other tubes that can be passed, maybe the NG tubes, can accidentally introduce these organisms into a patient's respiratory tract, of course, providing a hand or enhancing this infection. We also see what we call the bloodstream infections. Bloodstream infections, these are infections that the patient develops maybe due to cannulation or introduction of catheters. In so doing, this goes straight into the bloodstream and risks these patients to developing severe systemic infections majorly. Then we also see what we call the gastrointestinal infections. Gastrointestinal infections, in this case, we see most of them surfacing due to overuse of antibiotics. In other words, when someone has overused certain antibiotics, or they have been admitted and they are prescribed broad spectrum antibiotics of high potency. So these broad spectrum antibiotics of high potency destroy the normal flora, hence leaving microorganisms like Clostridium difficile and norovirus access to grow and develop in your body. And once they grow and develop in your body, these patients will always be characterized with severe diarrhea and several other abdominal discomforts. So that is those are the major common outline of these common infections that majorly surface for these patients that are admitted in the wards. Now, how can we as medical personnel counter this kind of infection? That means we can put in preventive measures that could help in preservation of our clients in this case. So we see practices that can be put into place. Could be one of them is hand hygiene. Hand hygiene, because when you move from one patient to another, you need to have your hands washed before and after the procedure in order to protect the next client from getting the infection of the previous client to the other one. Then you also see what we call the proper use of protective personal gears. Protective personal gears help a lot. Proper use of them help in protection of movement of infections from one person to another, or from the client and to you, the medical personnel, because this infection don't really care. Even if it's you is sick or any other person, there can be movement from one client to another due to poor use of personal protective equipment or gears. Then you also see what they call the aseptic techniques. If we are dealing with a sterile procedure or a surgical procedure that requires aseptic techniques to be followed, please, let's follow the aseptic techniques because they will secure these patients at the end of the day. Then you also have what we call the proper waste disposal. Proper waste disposal helps in to curb the infection that these patients get. For example, the patient maybe comes and the patient was diagnosed with a certain infection. The swabs and all those other things used for handling this patient should not be accessed by another patient because it will predispose the movement of one infection from one person to another who came with a different diagnosis, now getting another diagnosis within the facility. Then you also see what we call the environmental cleaning. For example, the water used in the facility has to be tested. That is one. Then of course, the air testing of the facility, including the air testing of the facility and the air testing inside the theaters where these aseptic techniques are done. Air testing has to be performed in order to curb this infection from moving from one patient and to another. Then you also see what they call the antimicrobial stewardship. That means well appropriated use of these antibiotics to avoid destruction of the normal flora that could predispose these clients into developing nosocomial infections at the end of the day. Then, of course, training of the staff. In several occasions, our staff need to be regularly trained in order to adapt to these technical errors that could be surfacing in the facility. And in so doing, it will help in the prevention of hospital-acquired infections. Thank you for attending, and I'll always be there to provide you this information. Make sure you follow, like, and share this video for a greater impact in our communities. Thank you.